Well, we have a health alert for women. If you've been putting off going to the doctor, you got to make some time to do that for you and for your family. You have to do it, as next week is all about celebrating your health mom. Joining us to talk about it is Timothy Hlavinka with the Urology Place. Thank you, doctor, for joining us today.
You're most welcome.
So many things we could talk about, but first and foremost, next week, Women's Health Week, what is it all about? Sounds obvious, but there's some issues going on there.
There's a week that is devoted to women's health. We have the Susan Komen race for breast cancer. We have women's heart ball. We have all the different specialties that have their focuses, but we don't really have a women's health week. And as we know, women deny themselves. The appointments are made for everybody else, their children, their husbands, their elderly parents. So it's a time for women to remember for a whole week there are many, many aspects of your health, and you need to focus on each and every one of them.
There aren't a lot of people, I would have to say, I don't think a lot of women know that this even exists, because it's one of those weeks that just doesn't seem, it seems to flow into all the other issues that affect women. You know, you've got Breast Cancer Awareness Month, and then you have Pancreatic Awareness Month. This is a week devoted solely for women to check out all gamuts of their health, right?
Absolutely.
Is there one thing that's more important?
Focus. I would say a visit to the primary care doctor if you haven't done that, because women until about age 50 think that the gynecologist is the only doctor that they need to see. After that, you really need to have a comprehensive health exam, and at least once a year. I think it's also important to recognize that this week is designed to be started at Mother's Day for a very reason, because mothers take care of themselves first. It's time to take care of you.
Yes.
Take care of everyone first. It's time to take care of you.
So here are some of the things that you've been talking about. First and foremost, visit your doctor for a checkup. That is sort of your overall, right? Your overall look at your health.
Absolutely.
Okay, and then get active. And obviously, I mean, we know why this is important, but let's hear it from a doctor, because so many different things range from lack of activity, right?
Absolutely. Getting physical, the 10,000 steps a day has been shown to have such incredible health benefits throughout our lives, and the immune system, the cardiovascular system, preventing cancer, no matter what you do, anti-aging, which is very important for both of us, both genders now.
Yeah, not smoking, that was another item on the list. Taking control of your diet.
Absolutely, absolutely, because obesity is also a killer, and obesity leads to a more difficult aging. It causes premature menopause. Many, many things are influenced by our weight.
Let's talk about, we were talking about in the break a little earlier, some of the things that we really lack as women in a whole, and you think that this is one of those areas for women?
Absolutely. I think the problem is that women get put into shoe boxes. You're so used to the annual visit to your gynecologist or your doctor, and this is a routine that goes through. And as I've seen women over the years, I've never seen one that wasn't just an incredible individual who needed to have that individual care. And most importantly, listen. Find a doctor who will listen to you, particularly when it comes to something that's so important like hormone replacement therapy. One of the problems most recently has been the issue of hormone replacement therapy and its safety. Tremendous amounts of research based on a study that was done about 15 years ago, which was essentially wrong, interpreted wrong, and promulgated wrong by the medical profession. And now we're just coming up with all the backlash of that 15 years later.
Wow, okay, so what I'm getting out of this is take control of your health, do the research, talk with your doctor, ask those questions, and really, really take charge of your health.
Absolutely.
Doctor, thank you so much.
You're quite welcome.
Next week, ladies, it's all about